Hi, I'm Jerry Waterworth, a volunteer with AARP Arizona. Today we want to share some basic information to help you navigate your Medicare choices. We know that making decisions about Medicare plans can be confusing and difficult. So we've created a series of videos to help you navigate the process. Today we're going to talk about open enrollment and original Medicare. Right now we're in an open enrollment period for Medicare. It runs from October 15 to December 7th. So check your mail for important notices about Medicare or Social Security regarding changes in coverage, costs, or service areas. Also, review your 2022 Medicare and You Handbook. You may have received it in the mail, and it looks like this. If you haven't received it, you can order one through Medicare.gov. If you're happy with your current plans, there's probably no need to take any action, but you can get personalized help in the community. You may be able to find free information and events online or from Medicare counselors in your area by phone, like the State Health Insurance Assistance Program. And we'll have their contact information later in this video. So let's get started with traditional or original Medicare. And there are several components to original Medicare. Part A covers hospitalization. That's inpatient care for hospital stays, skilled nursing care, hospice care, and home health care. The good news is that if you've worked for 10 years and have 40 credits for Social Security, Part A is already paid for and there is no additional premium. There are costs, however, when Part A kicks in that you should be aware of, including a deductible per benefit period and co-payments potentially based on the length of inpatient care. Part B covers medical care from doctors and specialists, outpatient care, durable medical equipment, and preventive services. There is a current base premium of $148.50 monthly, which will increase slightly for 2022. This premium is means tested, meaning that those with higher incomes may pay more for Part B. Also, there's an annual deductible, and be aware that Part B requires coinsurance of 20%. That means that Medicare will pay 80% of normal bills and the patient will be charged 20% of the service. That may add up quickly. So we'll touch on Medigap insurance or supplemental insurance, which can be used to cover those out-of-pocket expenses. Now, Part D covers prescription drugs through private insurance companies. Now, premiums for Part D can vary widely based on the plan selected, and most plans have an annual deductible, which can also vary. There's also coinsurance out-of-pocket costs based on annual spending, which is tracked for you by Medicare. Generally, the coinsurance is 25% of the drug cost up to the catastrophic level when it drops to 5%. But remember, coverage can vary widely based on the plan selected and the formulary of the plan, which is a list of drugs that are covered by that particular plan. So it's important to select the right plan for your situation. Please be aware that some things are currently not covered by Medicare, including long-term care, most dental care, dentures, eye examinations, cosmetic surgery, hearing aids, and routine foot care. Acupuncture was just added in 2021 as coverage. You might keep that in mind if you're not yet on Medicare and have other private or employer insurance, which covers these things. So if you can get these treated before you sign up for Medicare, you might save some money. And speaking of other coverage, Medicare will coordinate with other insurance you might have, including employer insurance, union coverage, VA services, TRICARE, or federal insurance. Medicare serves as primary coverage in most cases and secondary in others. Now let's talk for a moment about Medigap, or supplemental insurance. So with original Medicare, you have the option of purchasing supplemental insurance to cover certain out-of-pocket costs. Medigap will pay for deductibles, co-payments, and co-insurance for Parts A and B. But be aware that there is a 6-month pre-existing sign-up protection, which means that when you originally sign up for Part B, you have 6 months to enroll in a Medigap plan with no questions asked. If you have any pre-existing conditions, please be aware of this open window for enrollment. Now, there are many Medigap policies to choose from provided by many different companies. Benefits are standardized by the type of plan chosen, and unless you already have an F plan, most out-of-pocket costs can be covered except for the Part B deductible. And here's a slide showing the 10 types of plans that are currently available in the marketplace. So that's a brief summary of original Medicare, covering Part A, hospitalization, Part B, medical insurance, and Part D, drugs. We also covered Medigap or supplemental insurance. We have additional videos covering Medicare Advantage plans, or Part C, enrollment, help with Medicare costs, and other useful information. So for help on plan selection or additional information, you can contact the following: the State Health Insurance Assistance Program, or SHIP, at 800-432-4040, the Area Agency on Aging at 602-280-1059. You can contact Medicare through the website at medicare.gov or by phone at 800-633-4227. Access or Medicaid in Arizona is reachable through healthearizonaplus.gov or by phone at 855-432-7587. Or finally, you can look at the ARP website at arp.org/MedicareQA to get your common questions answered, or by phone at 888-687-2277. So thanks for joining us today for this overview on Original Medicare, part of our series on Medicare topics to help you be more informed and be better prepared to make your Medicare decisions. Goodbye for now.